First of all, Ross, if you're able to introduce yourself to us, that would be great. So perhaps give us a bit of your background as well.
Yeah, hi. So my name is Ross Abbott. I'm actually the head of health and wellbeing for a training consultancy company called Green Cross Global. I'm also delighted that I'm part of the advisory board for a brilliant charity called Ripple, and I work with the military to civilian transition, being a veteran of the armed forces of 24 years myself.
That's brilliant. Thank you. So I want to talk to you today about obviously this release that's just come out. For our audience who won't be familiar with it, it'd be better to hear from you directly than from me explaining it. So I wondered if you could perhaps give us a bit of an overview about what we're going to talk about today.
Yeah, so what happens every year is the Ministry of Defence release their data regarding suicide rates within the armed forces, so the Army, the Navy, Marines, and the Air Force. It's been released this morning and starts to look at actually the rates of suicide, causes of suicide, and specifically age groups as well, which is really important.
Thank you very much for the introduction. One of the first questions I have for you is what typically are the challenges for veterans in that transition phase and the long-term effects that transition can have on their mental health?
Yeah, so there's quite a few challenges from transitioning to civilian life. First of all, there's kind of a lack of structure and purpose sometimes. I know myself, I joined at 16, I left at 40. That's a big percentage of my life where it was heavily structured and I felt that I had a common purpose with everybody. And as soon as you transition into civilian street, that all changes. So that can lead to also social isolation and that loss of camaraderie, that being together, the close relationships, that shared sense of achievement, the goals, all of a sudden that can be lost. There can be a difficulty adjusting to civilian life, and where I struggled as well is of kind of moral compasses. And I'm not saying that there isn't moral compasses with the armed forces, there certainly is, but at certain points of your career, when you are operational, for example, and you're thinking what you're seeing and what you're absorbing and the action around you is kind of it's normal for your way of life. And actually, when you transition to civilian life, you realize actually that isn't the case. That in civilian life, everyone will have a different opinion, their own way of seeing the world, and that sometimes can be hard for the transition. There's also mental health challenges as well. I really went on my journey with my own mental health since leaving the forces because I became more aware of it. And for me, actually, it's because the lack of structure and lack of routine. So anyone who is living with mental health conditions, a lot of the time, routine and structure really helps with the management of that. And of course, when that all goes, suddenly, kind of you're left thinking, well, what was my service for? So yeah, lots and lots of challenges, being away from family long periods of time, and then all of a sudden you're sat back in the house with them 24 hours a day. So yeah, lots and lots of factors that make it a struggle for veterans coming into civilian life.
I think this transition is quite interesting to hear you talk about it. We've spoken to a few veterans in the past, and when we've spoken about, I guess, the transition back into civilian life is mainly mental health, which I'd like to touch upon a bit more if that's okay with you as well. But it's very interesting to hear about that transition into the actual life itself. It's that you mentioned the camaraderie. This is something we hear about a lot as well. Do you feel that the world is completely different from your time in service to the time after service, and there is perhaps a lack of understanding for people like myself, I guess, of that, the importance of being reintegrated into life after service.
Yeah, and I'm very thankful, for my time in the forces, and actually the forces now. So I transitioned about 10 years ago, 12 years ago, and the armed forces now is very different from the armed forces that I know, which is great. And we have to, society is seeing a really brilliant, emotionally literate Gen Z coming into the workforce, I'm more than happy to disclose how they're feeling about any neurodivergency, and the forces have to adapt with that. Otherwise, there's going to be a massive recruiting problem. So yeah, it's I think where I think I struggle slightly is that you get into a bit of a cocoon, a bit of a bubble, thinking that actually the wider world fully understands what you do and the reasons that why we're here. And then actually to transition to that, it can be quite hard because everybody in civilian life, they've all got their own struggles. They've got their own things going on. And actually, what you did, where you served, for a lot of people isn't greatly of importance to them. And that's sometimes hard to adjust to.
Absolutely, and I think we could really appreciate that as well. It's really difficult, I guess, for anyone really to understand really what veterans go through or have gone through. In terms of the mental health aspect of it as well, this is, again, as I said, something that we do discuss with veterans whenever we get the opportunity to speak to a veteran, and raise awareness of the mental health challenges as well. I mean, we know there's PTSD. It can, certain times of year, like fireworks displays, can cause a
Mm.
lot of anxiety, PTSD. What typically are the mental health challenges faced by veterans, and are you an advocate for speaking about it openly? I know you said you're quite open with your mental health, and I think that's really important because it's a step forwards. But do you think it's something that's kind of hush hush a bit too much, perhaps?
I think there are some great charities that are doing some amazing work to support the veteran community. Unfortunately, I was looking at the data for today as well. There's some great charities out there that do kind of alerts when veterans go missing from the community, from their families. And I saw from the data for that today is that there's actually a 56% increase in those charity reach outs for missing veterans this year from last year. I think I'm very blessed to be in the position that I am with my work and my charitable work, that I feel that I can openly talk about my mental health. And because that's what we need to do. Mental health isn't going away, suicide isn't going away, the figures are increasing. And so we're starting to talk about it. So we need to do more than that. We need to look at preventative measures. We need to look at the support networks, and that's why the great work that Ripple are doing are looking at, support mechanisms. But we need to start to also look at root causes of things. A lot of the time when we say that someone has died by suicide, the focus becomes on that word suicide. And actually, what we need to start to look at is the whys. Why has someone decided that they're going to end their life? And behind each of those statistics is a story. It could be to do with their service, it could be do with their financial status, their health, your mental health. There's a massive correlation between long-term mental health, PTSD, substance misuse. We put that into a boiling point and it becomes a really a really toxic environment where suicide becomes potentially a solution for an individual.
And that's really important. And I want to go back on what you just mentioned, because you said we need to look at the I guess the moments before someone decides they want to take their own life, and we need to prevent that. What do you think we could be doing? Is it more, do you think there's anything on the government level that could be done? Do you think it's more as a society we need to check in on our loved ones, and if we don't know any veterans around us, maybe engage with charities, working with them? What do you think could be done?
Yeah, I wish I had all day to carry on talking about this. So I think more government involvement. I know, we've just had budgets announced, and I know budgets from certain charities have been cut, and I know they struggled through the COVID period of not being able to raise money. I think we need to improve the NHS system, which is, don't get me wrong, I absolutely a big fan of the NHS, but it's oversubscribed and understaffed. So it's never going to work. The amount of people trying to reach these services is far greater than the time they've got spent to actually do this. I think we need to look at I say the root causes of things, you know, finances, the mental health support, you know, looking at that transition and supporting, but also then looking at, we've got right until the moment that someone acts on their ideation of suicide to save a life. And so that's why the tools like Ripple, which kind of looks at harmful online searches and actually will be like a digital support that will pop up onto screens. It can go in workplaces, it can go in train stations, it can go into universities, schools, sports clubs. You know, I saw yesterday, I think Surrey Cricket Club has just got involved in it. So people texting, you know, on their Wi-Fi, you know, on their phones, and they're texting harmful information, trying to search this. You know, this blocker can come in there and actually, you know, help support someone. You know, and to date, that's been responsible for saving 31 people's lives.
That's incredible. And thank you for talking about it as well. This is something I wanted to touch upon. So thank you for bringing it into focus as well. Do you think, obviously you talk about what we can do with charities, what the government could be helping support as well. Do you think we're gaining momentum with being able to really put the focus on veterans and the challenges they face? You mentioned all the different areas of life where they could be getting better support. So do you think we're gaining momentum?
I think by being here and talking about it shows that there is an interest, there is momentum. You know, when I look at kind of, you know, statistics, you know, since 2017, 526 deaths have happened in the forces or veterans through suicide. You know, and when we put that into perspective, in the Afghan conflict of 20 years, we lost 454 servicemen. You know, and there's a lot of reporting about actually, you know, all those individuals that made the ultimate sacrifice for their country, and yet when we're looking at suicide, we're in the same period, we're a greater number. So, and I think this is a trend throughout the whole of society. You know, we are getting there. Hence, you know, I'm giving chats like this. There's always more that can be done, but having that conversation is definitely the first start, and looking at the whys and looking at how we can support people.
Absolutely. Thank you. I'm glad we managed to get one last question in.
Okay.
And thank you so much for your time today, Ross. It was lovely to speak to you.